Hi, my name is Nick Peeperspy, at least on YouTube, and I'm fiddling around with my home video camera to talk about something that I deal with every day, which is Lyme disease. And a lot of people on YouTube have Lyme disease channels or Lyme disease TV, and I watch them and their videos, and I think that they are very helpful to someone like me. I'm not sure if they are something that educate the general public in any way that might be helpful, but they certainly are things that are very relatable and sort of comforting to someone else who's suffering with the disease. I don't really know what I hope to do by filming myself. However, anyone out there that's chronically ill with any kind of chronic illness knows that a lot of times it's activated in the middle of the night, which it is right now. It's 3:45 in the morning, and that also there's a lot of stress and pain, and our lives are sort of significantly diminished. And so I don't know if I'm hoping for this to be cathartic or what I'm hoping for. Anyway, I just sort of thought I would introduce what I'm doing. I've been sick for years, 10 years at least, and I've been to all sorts of different specialists, and they've tossed around illnesses to me like MS and ALS and fibromyalgia and arthritis. I've had varying diagnoses forever, and some of the misdiagnoses were, are very common for people with Lyme disease to receive, and so thusly I didn't sort of get better for the reasons that we were not always treating the complete source of the problem. However, I also, as a young person, I would go through periods where I was feeling very sick, and then sort of would go through periods where I felt better, and then I would avoid medical treatment and stop doing whatever protocol or refuse to follow up on doctors because I was finally able for a brief window to have a life, to hold a job, to be very active socially, that kind of thing. So it's a combination of the system not being largely equipped to deal with diagnosing and addressing Lyme disease, and me being a young moron who just always thought she was getting better. I've been diagnosed with classic Lyme disease and Babesia and Bartonella, something else, along with things that aren't directly related like beta strep and blood clotting problems. But so anyway, where I am in my Lyme disease treatment is I finally met a specialist. I went in February. Somebody had given me the name of a specialist, and I got to see her for the first time in February, thinking that she would be able to help me with fibromyalgia treatment and to figure out why I was sort of having very strange neuropathies. I was trying to complete cosmetology school, which is only supposed to be 13, 14 months maximum, and I was in it for 1.5 years because I kept taking sabbaticals for my health, and I was having strange reactions to the chemicals, and my hands would close up like this, and I'd wake up in the morning like this, and I wouldn't be able to open them, and I'm somebody who does a lot of performing theatrically, and all of a sudden when I danced, my feet would stay in the same position, and I'd have these horrible sort of cramps and twitches and oral hallucinations. And so anyway, I saw her for the first time in February. I think I was diagnosed by like April, so I'm still fairly new. It's August of 2010 now, and we're currently focusing on the Babesia treatments. And I'm not really sure. I thought I had figured out a schedule. I have certain medications I take that make me feel terrible. It's sort of like chemo. I've never had chemo, so I don't want somebody who's undergone treatment like that to be offended by my comparison. but I think it's probably pretty accurate just because some of the treatments that you utilize for Lyme disease actually make you a lot sicker temporarily as the drugs get into your system and fight. And so from what I understand about chemotherapy, you know, they're trying to get in and kill a cancer, and yeah, I lose my train of thought a lot. I'm not crazy. It's called brain fog. Today actually was a really good day. I was able to drive my car. I was able to walk around today without using a cane. I have a walker also, which is sort of feels tragic some days, but there's so many people on the planet that have it so much worse. So anyway, right now we're mostly addressing the babesia. Babesia is a co-infection of Lyme, and it's something that lives in the center of red blood cells. And my LLD, my Lyme literate doctor, thought that we should address that first, because maybe if I had red blood cell health or whatever, when we finally start aggressively treating the Lyme, the classic Lyme, which often involves intravenous therapies and stuff like that, my body might be in sort of healthier shape to handle treatment if we address the babesia first. I'm on loads of medication and lots of supplements too, which are very helpful, but I thought I would share sort of the basic regime. I'm just going through my bag, so nor am I a professional camera person. I probably look like a total dork. So I take, right now this is one of my antibiotics. I take 500 milligrams a day, and that's actually not very stressful. And these are pain meds. Of course, I have lots of different prescriptions of pain meds. And diflucan, which prevents the war and some of the damage that the constant antibiotics, everyday antibiotic use can cause. This is another one of the antibiotics I'm on every day. I take 5 of these. An inhaler. People with Lyme disease get something called air hunger, which actually it feels like your body is literally starving for air in the bloodstream, and it's not necessarily directly related to your lungs. However, sometimes there are asthma-like effects to that, so it's good to have an inhaler on hand, an albuterol inhaler. Aspirin, that's for completely sort of different. I have a blood clotting disorder that doesn't help my situation, so I take aspirin, and heparin, which is an anticoagulant, and I take it in a troche form, which is really cool. A troche is like a little gelatinous cube. Looks like a tiny ice cube tray with like jello in it, and you stick it in your mouth between your gum and your cheek and let it dissolve, and because of the fabulous science of troches, I don't have to inject my abdomen twice a day, so I'm very grateful for troches.